All right, so we're going to talk about anesthetic machines, and I think what I'll do to make it a little more, make a little more sense, hopefully, is I'll go through it as if I'm an oxygen molecule. So obviously these are the tanks. A couple of ways to attach the tanks. These are E-tanks, and you can have the larger tanks, which are yay tall, this big around. They're called H-tanks, and they fit about 10 times the oxygen that one of these small E-tanks will. And that you can have pipes come in, and you can put fixings in there, and they kind of snap in. But we don't have that. We have these. This is called a yoke right here, Y-O-K-E. And we have 2 oxygen tanks that will attach on there. So if we run low on one, we just turn that one off and flip the other one on, and then go fill this one. And it works well for us. They're very movable. We can move them around. So this is the oxygen tank here. I think what I'll turn it on, it's low, the pressure in it's low, so it needs to be filled, which hasn't been done yet today. So turn it on. And the pressure gauge right here, as you can see, reads about 500. That's about as low as we want it to get, because then it's getting too low and we don't have a whole lot of time left. So that's kind of our unwritten rule as to when we start filling it up. A full tank will be as high as 2,200 psi, pounds per square inch, up here on the valve. So I just turned the oxygen tank on, and what it does is it goes through here, through the connections right here, goes through the yoke out here, and this is where the pressure is being read, or it could come from this side if I had this tank on, okay? So the green hose, green is kind of standard for oxygen here in the United States. I think it's a different color in Europe. Don't quote me on that, but I think it is. And so green goes up here, and I'm going to turn this around. This goes to the flow meter here. In fact, I'll turn this up. In fact, it's on a little bit now, but I'll turn it up, and I have to turn this way. So this is about, let's put it on 2. I don't know if you can see it from back there, but this is a flow meter reading of 2 liters per minute. So I'll just turn it off for now. But as I turn it around, there's the green hose coming from the tank. Okay. Also, what you can see right here is, I'll come back to this, but this is the oxygen flush valve. So it will bypass, I get pure oxygen straight from here in the tubing, and this comes around to the circuit, and this is the tubing that comes from the vaporizer. We'll get to there in a second. So I can push this O2 flush valve here, right here, and we'll get straight O2 in there without going through the vaporizer and getting the gas. So you can dilute the anesthetic in the circuit that way if you want to, or if the bag starts to run low here, that's a way you can quickly fill it. So let's go back to the oxygen coming out of the tank. So it comes here into the flow meter. We turn the flow meter on. I turned it off for now, but this will regulate the flow from the tank here. This regulator decreases the pressure from, well, here it's 500 because this is low, but it could be as high as 2,200 psi, and it'll get it down to about 40 or 50 psi, and then through the flow meters lower yet to about 15 psi or thereabouts. Okay, so it goes to the flow meter, and that regulates how much oxygen we're going to get through here, obviously how many liters per minute. So it goes, and we turn the machine around. Here's the top of the flow meter after it goes through here. I'm going to follow the tubing around. It goes up to the meat and potatoes of this whole thing, which is right here, which is our vaporizer. This is an isoflurane vaporizer. So it goes into the vaporizer. We turn it on, like so, wherever the setting we want. It goes through one side of the vaporizer to the other, and it picks up the anesthetic gas. The oxygen is the carrier for the anesthetic gas. As I said, isoflurane in this case. So let me turn it around, and we'll keep following the tubes. So here it comes out of the vaporizer. This is an out of circle precision vaporizer. It has to be out of the circle because it needs a little higher flow because there's more resistance in these than a non-precision. So a non-precision can be inside the circle, which is a much lower PSI, much lower. So comes out, comes up here, and here's the little white piece coming from the oxygen flush valve, and it comes up here, so we can get, that's how we can get the straight oxygen in here that would dilute this one coming from here, which comes from the vaporizer. So it comes up here, and this is where it attaches right there into the circle. So in the circle, flip around this way, we've got a couple of things. We've got the inspiratory one-way valve here, which allows it to go through the tubing, which goes to the patient. We connect this to the endotracheal tube in the patient. So whatever the pressure is in here is also the pressure down here in the patient's lungs. We have a reservoir bag which is going to fill up because most of the time they're going to breathe a little more than is in the tubing. So this is a little bag for excess oxygen mixed with the anesthetic, and you'll see that collapse in and out as it's on a live patient. Goes into the patient, it's breathed out because of the one-way valve and some resistance. This is a passive system. There's always some coming this way. It won't go up this way because it's passive. There's just a little bit too much resistance to go that way. It just goes through the path of least resistance. Up here to the expiratory valve, this is a one-way valve as well. From here it can do one of two things. It can go down here into the CO2 absorbing soda lime canister, and then from there the CO2 is picked up, and then it comes back here, and lo and behold, here we are back here where we came in the first place. So that's the circle, and it just circulates around the circle, taking out the CO2 that's breathed out and exhaled by the patient. So as I said, you can go one of two ways from here. You can go back into the circle via the CO2 absorbing canister, or you can go out here if there's a little extra flow. You can go out here to, let's follow this tubing, down here, which is our scavenger system, and it picks up the anesthetic gases so it doesn't go into the environment and we don't have to breathe it in. That's not too safe. Let me go back up here again to where we got the one of two choices, going back to the circle through the soda lime CO2 absorbing canister, or this is, or back this way, and again, this is the pop-off valve. So we close it down, and that will keep the oxygen and anesthetic gas from escaping out here. This is just, it's like a little escape valve. Pop-up valve is an escape valve. We never, ever close it. And I don't know of a facility that does keep it completely closed. That's a completely closed system. This is technically called a semi-closed system because we keep it partially open. I have a little thing here that was rigged up by someone who does our anesthesia machine maintenance that he kind of made himself, and it's really handy. If we want to bag a patient, instead of closing this down, giving them a sigh breath or relief, and then opening it back up, that's a bit cumbersome, and especially if you forget to do it, you could kill your patient because you're going to get too much pressure in here. You've noticed this bag would fill up like a big old water balloon, and they just can't breathe against that pressure. There's way too much pressure in here. So we close this down, and that closes this as if we were closing this pop-off valve, and that just closes the system completely. Then we do that and release. It's kind of a handy little thing. I don't know what he calls it. One other thing I want to mention is there's one more meter here, if you want to call that, measuring device, and this is the manometer, and it measures how much pressure is in the circle. As you can see, it's attached to part of the top of the CO2 canister, and again, this is part of the circle. It probably doesn't matter where you put it. You could put it here or here or wherever, because the circle should have the same pressure throughout the whole circle system. And this is how much pressure is in the circle system, which also means how much pressure is in the patient's lungs. The most we want is 20 centimeters, and that's in measuring centimeters of water. So the most we want is 20. If we're bagging the patient, we want 20, maybe a little less if it's a young animal, puppy or kitten with a really compliant rib cage. I think that kind of completes everything, and I hope that made sense.